Hi, Mrs. Mustain. It's Alina Sibley, the nurse practitioner. How are you doing?
Hi, I'm fine. I'm having a good day today.
Good, good. I came to see you because I'm aware that you recently tested positive for COVID, and I'm really sorry about that. I'm sure it's worrying you a little bit. I wanted to take the opportunity to talk to you a little bit about kind of what that means. I know it can be a little scary, but I think it's important to talk about kind of, the future and what that means. What do you think?
Okay. Sure. I am worried now that I have the virus. I am worried.
Yeah, yeah.
Yeah.
What do you know about the coronavirus? Is there anything that I can answer for you?
Well, I know it's killing a lot of older adults like me. Yeah.
Yes. I have you thought about how it might affect your own health?
Well, I'm worried how it's going to affect me because of my COPD. Yes, I am worried about that.
Can you tell me a little bit more about that? What concerns you about that, and what do you think lies ahead when it comes to that?
Well, I'm worried. I'm worried about my breathing and how I'm going to do with it. Yeah, and I'm worried about it. My breathing isn't always good, and so how is it going to be once I have the virus? Now that I have the virus.
Right. I can understand. I can understand why that worries you.
Yeah.
Some people get a mild form of the virus and do really well. They recover okay. Some have long-lasting complications. Some do really poorly if they have a severe form. They do really poorly with their breathing, and sometimes they end up on machines. Some people don't survive those machines. If people do survive and they have these complications, the complications can be maybe confusion, long-lasting weakness where they need kind of long-term, more rehab and getting stronger. Sometimes they can't return to the things that they used to enjoy. Sometimes there can be kidney issues. I also worry about your COPD and how you might do. It's also possible during this pandemic time. You've heard that some families aren't allowed in to the emergency room or the hospital, so it kind of depends, but there may not be a lot of family members that can be with you if with people when they're in the hospital. So that's a concern. I know this is really hard to hear, all of this. What are your thoughts about this?
Well, I know I don't want to be on machines. And I do know I really want my family, as many family members as can be around me.
Yeah.
But what if I recover and I go home? What if I'm one of the mild cases?
Well, that would be the hope. That would be the hope. It's not a guarantee, and that's the concern. I do worry about your advanced COPD, that you might not do well, but I want to support you with whatever care you want, and that's why it's important to have this conversation. I know this is a lot to take in, but I think it's important. So, yeah.
Yeah. Well, I don't know. My mother died in the hospital, and that was very hard for me. And I wish I could have brought her home and been near her in my home. I felt like she would have had a better experience, and I think I would have had a better experience.
Yeah.
And I just don't want to suffer. I don't.
Yeah.
I want my family around me.
I'm really sorry to hear what you had to go through with your mother. That's tough. This is why having this conversation is important while you're doing okay. So reviewing kind of the possible outcomes and then supporting you with whatever decision you make is important. Do you have any more thoughts about this?
Well, I really don't know what to do. I know I don't want to die alone in the hospital.
Yeah.
I know I want my family around me, and I know I don't want a tube stuck down my throat. I do know that.
So it sounds like you already kind of have an idea of definitely what you would not want. Is it okay if I give a recommendation based on what I hear you saying?
Sure, I'd appreciate that.
Yeah, yeah. So I would recommend that we continue to treat you aggressively here. Hope for the best possible recovery. If, however, your breathing gets a lot worse and we're worried that time may be short because you're just kind of, not recovering the way we would want you to, that we still continue to support you here aggressively in a comfort way, to keep you as comfortable as possible, instead of you going to the hospital to be put on machines. What do you think?
I think that sounds good. I think that's the way I'd probably be most comfortable with. That way my family can be around me.
Yeah.
Yeah.
We can definitely communicate that with them, and it'd be good to involve your whoever your healthcare proxy is. I think it's your daughter, in some of those conversations, so that she's aware also of kind of what we've been talking about. Would that be okay?
Yeah, actually, she's coming today to visit, so
Okay,
I'll have
good.
a conversation with her about that.
Great. Good. Thank you so much for having this conversation with me. It's important to know what your wishes kind of are, and to come up with a plan. So thank you for having the conversation with me.
Oh, thank you, honey. It was very helpful for me. I appreciate your time. I really do.
right.
Thank you.
Take care. We'll talk again soon.
Okay.
Okay.
Bye.
Bye-bye.